Okay, for this assessment, I will be assessing the ears, nose, and throat. My name is Lena Hall. I'm a family nurse practitioner student. Do I have your consent from the patient to perform this exam?
Yes.
Okay, so first I will start off with assessing the ears. The ears are symmetrical. There's no masses. I'm going to pull on the auricles. Do you feel any pressure, any pain?
No.
There's no masses observed. Ears are intact. So I will start with the hearing acuity test. I'm going to occlude one side of your ear and whisper in this ear either 3 letters or 3 numbers. Tell me what you hear.
A, B, C.
Okay, and I'll do the other side.
1, 2, 3.
Okay, good. Now I'm going to look at the inside of your ear with the otoscope. You will feel me grab the back of your ear, and I will be pulling back on the auricle while supporting the patient's head and neck so they do not move their head or neck while I'm inserting this in their ear. Let me know if you feel any pressure. There is no foreign objects, redness, masses in the ear. There is earwax, small amount, and the temporal membrane is a pearly gray and intact. We'll be checking the other side, pulling back on the auricle, raising the neck and head with my other hand. No foreign objects, no redness, earwax, temporal membrane is a pearly gray. Okay. Now I will be doing a hearing test with for a conductive versus sensorineural hearing test, which is the Weber test and the Rhine test. The Weber test, I will strike the tuning fork on my hand and place it above your head. Tell me if you can hear it better in one or the other ear, or if you hear it equally. Are you ready?
I can hear it equally.
Okay, thank you. Now for the Rhine test, I'm going to strike the tuning fork on my palm, and I'll be placing the tuning fork up against your mastoid bone. You tell me when you can hear it, and then when you cannot hear it, I pull it away and pull it in front of your ear, and you tell me when you don't hear it in front anymore. Okay?
Okay.
Ready?
Yep.
It's against the mastoid bone.
Yep. Yep.
Okay. And that is for the bone conductive and the air conductive. It's the other side. It's against the mastoid bone.
Yep. Yep.
Okay. Both are approximately 6 seconds. Now I will be inspecting the patient's nose. I will be looking at the nose. There is no masses, discoloration, skin is intact. There is no dryness of the nose. And I'm going to palpate your sinuses. Tell me if you feel any pressure underneath your eyes and the sinuses there.
No.
And above the eyes, under the brow line on the pressure, sinuses. No. Okay. Now I'm going to have you occlude one side of your nose. Breathe in. Okay. Other side, please. Okay. Good. So now I'm going to assess the internal of the nose with a visual light. Does not touch the center of your nose. Okay. Now I'm going to assess the mucosa in the inside of your nose. Okay. No redness, no abnormal masses? Any pain or anything in your nose?
No.
Mucosa is intact. No irregular redness, no bleeding, and the septum not deviated. That is it for the nose. Now I'm going to inspect the patient's mouth. Looking at the patient's mouth, can I have you smile for me? Okay. Symmetrical, no drooping of the mouth. Lips appear to be dry. No cracking though. Can you open your mouth for me? I'm going to shine a light in the inside and observe. Hard palate is intact. There's no masses. The tongue is intact. There is no bleeding of the gums. Teeth, there's no missing teeth. Go ahead and stick your tongue out. No fissures in the tongue, no abnormal, no masses. Go ahead and put your tongue in. Okay. All right, stick your tongue out. Say ah.
Ah.
Uvula moves with a soft palate. Soft palate is in tongue. Pharynx. Soft palate moves with the uvula when you say ah. Tonsils are not inflamed or no redness. No masses observed back there. And the pharynx is intact. Okay. Now I'm going to don gloves as I'm going to be inspecting the inside of your mouth. Okay, go ahead and stick your tongue out for me. I'm going to grip your tongue and move it. Okay. No masses. No abnormal color, no swelling. Open your mouth, please. Okay. So checking the teeth. No loose teeth. No bleeding of the gums. Do you have any soreness in your mouth or anything?
No.
Okay, go ahead and stick your tongue out for me again. Move it side to side. Okay. The patient was able to move the tongue. There was no abnormal movements of the face. And everything, it is intact. There's no swelling, no abnormal signs, no masses, discoloration, no bleeding. And that is it for that.